There had been a polio outbreak recently in Borno. In 2 years, there hadn't been a case. Everyone thought polio was gone. I was actually following up on the polio situation and started seeing reports from the Borno government and others that this huge crisis was underway, and everybody knew Boko Haram was there and committed terrible atrocities. But no one knew how many people had been trapped living under Boko Haram control. The army came in and started liberating areas. That's when they realized that there were millions of people who had been deprived of everything for about 5 or 8 years. Almost 2 million people have been displaced, and they're crowding into camps that can't accommodate them and communities that are so poor that they can't feed themselves in the first place.
8.5 million people are in need of humanitarian assistance. 5.1 million are malnourished. More than half of those children. The UN estimates that without treatment, 75,000 of those children will die by June.
Polio essentially is a sign that the health system has collapsed. Malaria, child mortality was off the charts, and a measles outbreak. And I was horrified by the combination of malnutrition and infectious disease. My name is Leslie Roberts, and I'm a deputy news editor at Science magazine. I went to northern Nigeria to look at this humanitarian crisis with support from the Pulitzer Center on Crisis Reporting. The worst of the crisis is concentrated in Borno. We visited Maiduguri. The first thing we did was go to the feeding center. It was in a courtyard with lots of women with their children waiting, and these were kids who had already been screened, and they had severe acute malnutrition, which is the worst kind. And if you're not treated, 1 in 5 dies. But these kids were already on treatment. They're getting the ready-to-eat therapeutic food, and they would measure the kid's arm to see if they were recovering. Malnutrition, it's bad enough in itself, and then it suppresses the immune system. So when you get these infections, a severely malnourished child is 9 times more likely to die. The next day, we took the UN helicopter to Manguno, in the very northeast corner of the state, which has only been open for about 6 months. The areas around it are still under Boko Haram control, and the conditions here are even worse than in Maiduguri. There we went to a UNICEF clinic, and the health worker would ask, how long has your kid been sick? What are the symptoms? The kid would have fever and cough. Ordinarily you use a rapid diagnostic test, which is a finger prick of blood, but hers had expired. So she had no choice but to treat everybody as if they had malaria. We went to that transit post. This is something that the Polio Eradication Initiative has started fairly recently. They usually go door to door and vaccinate kids. But in Nigeria, in this crisis, so many people are on the move. They find that they're missing a lot of kids. So they select, in this case, it's a road that goes between 2 areas that are completely inaccessible under Boko Haram control, and also heads into Maiduguri, the capital. So they could get people fleeing Boko Haram, they could get nomads. Anytime a woman goes by with a child, they fly her over and see if the child has been vaccinated, and if not, vaccinate the child. One young doctor took us to the measles ward. Nobody knows exactly how many kids are affected, but he was saying, I don't need lab confirmation, this is huge. And he's seeing more than 40 kids a week. First, they have the rash. The kids have conjunctivitis, their eyes are swollen, and if it's not treated, it can lead to blindness. A lot have respiratory infections, and there were kids who had to be on oxygen. Other kids have diarrhea that's so bad they're on IVs. Some of the children have sores in their mouth so they can't eat, which exacerbates malnutrition. In a developing country without a crisis, you'd see about 2% mortality. And disasters like this, you see 10% or sometimes even 30%. There are easy fixes for a lot of these problems. The biggest need is really the screening for malnutrition and treating these kids with food. The Army, the Air Force have to continue their fight, and then more money, more aid groups, relief groups need to get in, need to get access. But the scale is so big, and so many are inaccessible still. To talk to the people about what had happened to them, it was devastating. That they all had tales of children they'd lost or husbands had been murdered. And it just seemed so appalling that nothing had been done. It's this forgotten place. And part of it is there are so many crises all over the world right now that they're all vying for the same pot of money. But for some reason, Nigeria seems to be at the bottom of the list.